Here now two questions. An otherwise healthy 34-year-old woman calls the office because of non-specific left-sided chest pain and mild shortness of breath 2 weeks after she underwent abdominoplasty with plication of the rectus, diastasis, and liposuction of flanks. The procedure was performed during general anesthesia in 3 hours and 15 minutes. She was admitted overnight, and heparin was administered subcutaneously during her hospital stay, including one dose postoperatively. She reports no postoperative complications and feels extremely well otherwise. She says that she is finally getting back to herself physically and doesn't want to worry her husband or children. She doesn't she just wanted to make sure that she hasn't pulled a muscle or injured anything. Which of the following is the most appropriate action by the plastic surgeon? A. Evaluation at the emergency department. B. Reassurance. C. Reduction of physical activity. C. D. Use of incentive spirometer at home to assist in improvement pulmonary toilet. Use of over the contour anti-inflammatory drugs. The correct answer is A, which is evaluation at the emergency department. This patient is likely suffering from a pulmonary embolism and requires emergent workup and treatment with anticoagulation. Although she was treated preoperatively and with subcutaneous heparin, deep vein thrombosis DVT can still develop, as well as a resultant pulmonary embolism PE. In one survey of board certified plastic surgeons, PE was found to be the leading cause of death following liposuction. In aesthetic plastic surgery patients, abdominoplasty patients appear to be at a higher risk of venous thromboembolism VTE when compared to those undergoing other commonly performed elective procedures. Rates range from 1 in 1000 to 1 in 3 for standard abdominoplasty, and when combined with other procedures, the risk of VTE and death from PE increase significantly. Any possible symptoms that are suspicious for immediate presentation to the closest emergency department for aggressive and urgent medical workup, as well as imaging and laboratory studies to evaluate for DVT and or PE, pulmonary embolism. The other question, the first one was about 34-year-old woman. The other one is about 30-year-old woman is brought to the emergency department one day after undergoing. The other one, it was more long time after undergoing outpatient liposuction because of difficulty of breathing and confusion. A tumescent technique with lidocaine was used during the procedure, in which 4,000 ml of tumescent fluid was infiltrated and 4,000 ml of lipoaspirate was removed. Physical examination shows respiratory distress and petechial rash. Which of the following is the most likely cause of this patient's condition? It's A, drug allergy, or fat embolism, or lidocaine toxicity, or pulmonary edema, or pulmonary embolism. It is the choice B, fat embolism. A known risk of liposuction is fat embolism syndrome, and clinical examination remains the gold standard for diagnosis. The three classic symptoms of FES are respiratory distress, decreased cerebral function, and petechial rash. This generally occurs within 48 hours post-operatively with manual disruption of both fatty tissue and blood vessels that occurs with liposuction. Microparticulate fat showers the lungs, brain, kidney, and skin with emboli leading to mechanical obstructions and or biomechanical inflammatory reaction. Overall mortality from FES after liposuction is approximately 10 to 15%. Lidocaine at high concentrations can cause serious central nervous system disturbances, including anxiety, agitation, psychosis, seizures, and or coma, and cardiovascular toxicity, including arrhythmias and hypertension. Symptoms of toxicity including lightheadedness, euphoria, digital paresthesia, restlessness, and drowsiness. Symptoms of objective toxicity include nausea, vomiting, tremors, blurred vision, tinnitus, confusion, excitement, physiologic psychosis, and levels reach 8. Psychosis, and muscular fasciculations, seizures, and cardiorespiratory depression occur typically when blood levels reach 8 to 12 microgram per ml. Above this level, subject may become comatose. Subjects may become comatose with respiratory arrest and cardiac asystole. ARASH is not associated with lidocaine toxicity. The safe dose of lidocaine has been established as 35 mg per kg during liposuction, and some authors suggest using 55 mg per kg may be safe. Anaphylaxis from a drug allergy also doesn't cause a rash but can cause respiratory distress from laryngeal edema. Pulmonary edema is characterized by respiratory distress and that doesn't respond to oxygen therapy. This can occur because of fluid overload or from physiologic issues related to extubation. So according to those questions, I want you to compare between them. There is fat embolism, and the other one should be evaluated at the emergency department. Please subscribe to my YouTube channel, share this video with your friends, make like, and give me a comment about your answer.